Did you know that premature kids have a higher risk of autism? Today, we are talking about that with Jannette, who's been in my online world for over 2 years. And she tells her story from her son, who was extremely premature until now, when he's 4 years old now. And we also talk more about prematurity, denial, just some of the confusion that goes on when kids start showing delays or possible signs of autism after they have premature births. So let's get to this really great interview with Jannette. Jannette, it is so nice to see you today, and thank you for joining us.
Thank you. Likewise. Lovely to be here. Thank you for having me.
Yeah, so you've been in my world for 2 years, I think. And but I only recently saw you on Zoom for the first time and did a little interview. So I really wanted to bring you to my bigger audience because you're just a wealth of information. So before we get into the main topic, which is going to be prematurity and autism and how to figure out if the delays are related to prematurity or autism or both, why don't you tell our listeners and me about your fall into the autism world? Just a couple minutes.
Okay, sure. So I had my son in 2019, and he was born 3 months early. So his gestational age at birth was 26 weeks and 5 days. And he spent 91 days in the NICU. When I brought him home from the hospital, he I didn't feel like we were connecting. Like normally they say that, there's that connection. And I wasn't sure if it was because, he was, basically behind plexiglass for 91 days. And also, he was a bottle fed baby. So I wasn't sure if that had something to do with it. And it was kind of like he was in a little cocoon, if that makes sense. So he was happy when he was fed, when he was changed, he was happy to snuggle, to be on my chest, those type of connections. But any kind of looking at me or, focusing on my face or those type of things, those things weren't there. They did come, but it was very slow going. So it came over the next, few months. And then those connections were starting to come through a little bit more. But I did notice that when I first had him. And then when he was about 18 months old, I have a friend who was bringing to my attention, she says, Jannette, Gregory is my son. Do you think he might be a little autistic? And I think she didn't know how to broach that with me. She says, because I'm calling his name and he's not really answering and, and the eye contact. So I said, no, it's just that he's, he was born early, because that's what everybody was echoing around me. And she also had very early, so micro-prem twins who are a lot older than Gregory. And so she knew that looked different. And on her husband's side of the family, they also have many family members with autism. So I think she had seen that before, which is why, those things were catching her eye. And she's also a nurse, as am I. So, and she worked in pediatrics for like a decade. So I think all of those things combined, at 18 months, she was already starting to see those signs.
And at 18 months, until she mentioned it, you weren't thinking autism, right?
No, because when the babies are born early, well, we always do what's called a corrected age. So because he was born 3 months early, we always adjust. So at 18 months, it would have been actual, and then, it would have probably been about 15 months corrected age. So because we always did those corrections, and everybody said he was just delayed, I assumed it was just because those skills were coming in slower. Yeah.
And at what age do you stop doing the corrected?
So you do it on the anniversary of their second, what would have been their due date. So at 2.
Okay.
Right.
That's when you stop correcting. Okay. So, so once she planted the seed, then did you start looking into it, or were you still in denial?
I think I started asking around a little bit. I started Googling a little bit, because I knew that when I brought him home from the hospital, and there was other things along the way that, once I kind of thought about it. So he loved to focus on ceiling fans. And he would just love to watch those ceiling fans, and I'd have to take his gaze away from it. It was that strong. So there was things like that. I didn't know what that was at the time, but I knew it wasn't what I thought would be, kind of a normal thing. So I thought that seems different. And I didn't know where to categorize that. And that was before the 18 months. Excuse me. His all of his healthcare professionals, they said, he's just delayed, Jannette, he's just delayed. And so, but she planted the seed, and because we're such good friends, she's actually his godmother. So she kind of was on that journey with me. And, so that kind of, when I really thought, okay, this is something that I cannot deny anymore, no matter what anybody's saying, is that after his second birthday, so I took him for his, 2-year appointment. So when he went there, he passed his MCHAT. Is he pointing? Yes. At that point, he had only pointed twice in his entire life, and he was 2. He pointed at a plane and he pointed at the waves. And I thought that's pretty good pointing, but not
So you marked it
realizing.
as yes, so he passed that part of the
Right,
MCHAT.
because is he pointing, Jannette? Yes, he certainly is pointing. But he was not fully verbal at that point. He had about 40 words, 50 if I was generous. And because he wasn't speaking, he should have been pointing all the time to get my attention, things like that. And that was not happening. So I didn't realize that it had to be that with that level of consistency. So I ticked, yes, he's pointing. And then after his second birthday, I don't know, 2-3 weeks after, maybe, he lost his words for about a month and a half. Then I got really, really concerned. And we were in one of the local supermarkets, and, then there was COVID. So that kind of played a role too. Everybody was in their own little bubbles and all these things. So I thought, okay, he's probably even more delayed because of that. But when he lost his words, that was very concerning, because nobody could tell me where his words went. And when we were in the grocery store, he made these vocalizations, and he must have done it like 20 times in a row. I mean, it was really, and like he couldn't help himself with making it. And the gentleman in the shop turned around at me. He says, he says, boy, he makes that sound a lot. And my heart just sank. And when we left the grocery store, I said, oh, no. We have a problem here, and I need to figure this out. So I started Googling a lot. And I did a lot of Googling with autism versus prematurity versus global delay. I didn't know what that looked like and how to tease those things out. And that's when I found your programs. I found you online, and then I took a webinar. So that's how I got to you.
Okay.
And yeah.
Well, that's great. So he was a little over 2. But let's go back before we dive into like what you did and how he's doing now, which is he's doing great.
Yes.
But let's talk a little bit more about prematurity, and I knew a little bit about it when I was writing my book. I was seeing that studies do show, including a 2021 study from the American Academy of Pediatrics, which we're going to link in the show notes. That'll be at marybarbera.com/244 will be the podcast and the show notes. Is Autism and Prematurity article, which shows basically the more premature you are, like the micro preemies, the really preemies, 25 weeks, 26 weeks, they have a 6% chance of developing autism versus 38 weeks, they have a slightly increased over the 1.4% that full-term babies have. They might have a 1.6%. And the more, in between there, it's really is a strong correlation between how premature you are is the higher rate.
Correct.
So I'm assuming when he was discharged from the hospital, or when he was a micro preemie, you probably hear a bunch of scary things, like he could be visually impaired, he could be hearing impaired, he could be cognitively, like what kind of things they tell you when you have a micro preemie?
So they actually were really great. I actually had him in a different country, because microprems are before 28 weeks. And here where I live, they send us overseas when the babies are born that early.
You live in Bermuda.
Correct.
Did you deliver
in
him?
Canada? I had him in Canada.
Okay.
So where I had him, thankfully, they were just amazing because they had a wonderful NICU program, and they have very high, obviously success rates and things like this. So they did a lot of teaching, and we had a lot of, we were captive audiences. We were there so long. So they had, classes every week and things like this. And, I always remember them. So Gregory, he didn't have any brain bleeds. So because I'm a nurse as well, I'm like, okay, every time he did have, some issues on his echo that they corrected, closing that whole, the PDA and things like this. But other than that, so what they did mention that, hearing, so they come and they test them. It's kind of very basic testing that they do to see if they get feedback. So they did that in the NICU, and I had to, we followed up out as an outpatient as well. The eyes, because they're on, they're ventilated, they have CPAP, they have, NIV-NAVA, all these things. Because of all of the oxygen, they can be at risk for having, retinopathy of prematurity. So they test them for that. And so also I had preeclampsia in my particular case. So that also puts, the child more at risk for autism as well. So I remember the doctor.
Did they say autism when he was premature? Did they say that it is higher risk?
No, we just knew that as having microprems, that we are more at risk for that. So it's kind of a general thing. I remember when I asked one of the physicians I said, so form doesn't equal function. She said, no, form does not equal function. Meaning, those organs are so underdeveloped that even though he didn't have a brain bleed, even though his brain looked like it was developing, she said, sometimes we have babies who have, 2, 3, 4, brain bleeds, and they do great. And sometimes the ones that don't have issues. So we just have to wait and see how they, develop and progress. So that was always in my mind. So when when you get discharged, you have an appointment with the eye specialist. He eventually got a hearing test, all these different things that you're just trying to get out of the woods of the prematurity. Much less anything, so you got a lot coming at you.
Like your friend who had twins, multiple births are actually more risk of prematurity. Mm-hmm. And I do talk in chapter 1 or chapter 2 of my Turn Autism Around book about a little bit about twins and siblings. And I did have premature twins that I worked with in early intervention. One twin was diagnosed, one twin was not diagnosed. And they were pretty, I'm not sure what week they were, but they were premature. And so I think there's a general, could have vision problems, could have hearing problems, could have learning disabilities, but it's also like, the way the world is, making progress every day. And was he even a pound, or like what was?
So he weighed, so that's another great point. So he weighed 710 grams, which is roughly like 1.5 pounds. Okay. So for the babies that are born under 2 pounds, that's another risk factor.
Yeah.
So the low birth, very low birth weight. So he really had a lot that, he was battling against, a real uphill kind of battle for him.
Right.
Yeah.
Right. And, there's, I'm sure people listening now, we don't want to freak people out even.
No.
So
no,
we're both nurses. We see, but we see also kids do really well, like your son, which we're going to talk about how he's doing, and the twins that I worked with did really well. And so it just means it makes it more confusing. Like
makes it more confusing.
And you're constantly like, even both my boys were born full term, but their birthdays, where they fall. Like Lucas was a summer birthday, so he started the 2-year-old preschool in the fall, right after he turned 2, where their kids having their 3rd birthdays. The difference between a 2-year-old who's delayed and actually autistic, which I didn't realize, and a 3-year-old typical kid is obviously huge differences. So I think even if you don't have a premature child, if they're showing signs of autism or other things, you can tend to make excuses for, it's COVID, he's premature, he's a summer birthday.
Right. And that's actually what happened. That's exactly what happened. And then I feel like everybody was doing that, right? And so I'm thinking, okay, because, that's the other thing, and maybe we'll get into that a little bit, but he did a lot great. I mean, from where he started, to where he did really great. But
Yeah.
there was these
So
other things.
why don't you tell us? So he just had his 4th birthday.
Yeah.
And actually he's a July birthday, just like Lucas. Like they're a day
Yes,
apart. So you have that. Okay, so he just turned 4. You've been in my courses and in my world as a very active participant in our communities, posting a lot and sharing your story and being very generous with your videos, with your pictures, with your story, which is great. So from 2 to 4, can you kind of describe where you started and where he's at now?
Right. So when Gregory was 2, so he had lost those words, and they came back after a month and a half. Everything I was, kind of looking at online said the mark was 2 months. If it was more than 2 months, then they would think that it was something medical. So I was like, oh, well, it's a month and a half. But his words did come back, and they came back, and with some new ones as well. But it was still a mystery. Where did the words go? So in that, during that time, I found you online, and then I took the webinar, and then I signed up for the courses because I knew immediately you gave 10 signs of possible autism, for us to look out for. And he had like 8 of them.
Right.
So I
And
said,
those
oh,
are
no.
in chapter 2 of Turn Autism Around. We also have a whole podcast episode on the 10 signs. These aren't the classic 10 signs. These are the 10 signs I saw with my son and others as a professional. So there are like behavior problems isn't listed on the MChat, but if you don't have enough language and you can't get your point across, you're going to have problem behaviors, and you're going to have, trouble going to the doctor's, dentist, haircuts, and all kinds of things. So those 10 signs we can link in the show notes as well. So you dove
Right.
into the toddler preschooler course.
Yes, I did. So with that, it helped me to kind of get out of my own, because part of it was my own denial. We look at our children, we think they're perfect. And it's very easy to kind of agree with everybody to say, yeah, you know what, he's just delayed. He just needs a chance, to kind of catch up. But what he wasn't doing, so what I knew, oh no, this is not prematurity. So teasing those things out. So with prematurity, what everything says that I've read is that it's just, they get to those milestones, but it just takes them a little longer, but they get there. So, with the lack of pointing, that doesn't really have anything to do with that, right? He should have been pointing, even it might have come in a little bit later, but definitely by 2, that point should have been very strong, trying to get my attention. He never hand led, nothing. So that lack of pointing, because you always taught us when they're not verbal, they should be pointing at everything to get our attention. So that's one.
Not 2 times in their whole lifetime, or
not
even
2
2 times
that I caught on a picture.
Correct.
Correct.
It should be a few.
I remember you saying, we're not asking you if they're pointing once a month. And that really hit home for me. I said, okay, I got it. So the speech delay, definitely, but that loss of language and that loss of, that was actually a regression for him. And so that loss of language, that's another one. Unresponsive to his name. So, when I was Googling all this stuff, oh, they don't listen to their name. I said, but he listens to his name. So he was in a pumpkin seat at that time, so facing opposite me in the car. And I literally tested him like 30 times. I called his name, and 100% of those times he turned and looked at me. But if you would expand that, so he did really well with myself, my husband, and his babysitter. That was his world, especially during COVID. And in those environments, he responded very accurately and high level accuracy. But if it was anybody else, so when COVID kind of relaxed a little bit and we started to integrate more with friends and family, it was like he was deaf. I mean, you could be right next to him and call his name, and I knew he wasn't deaf. So, the inconsistency, I guess, is what I'm getting at, that it should be consistent in all environments.
And then we would call Lucas's name, he wouldn't respond. And then the TV would be on, and he loved the Pennsylvania lottery, and he'd come running around the corner and he's like, well, he's not deaf if he heard that little jingle.
Correct. And I remember you saying that, and I remember thinking that's Gregory, because he'll run out of the room and he'll come to something that catches his attention. So he had to have heard it. Delayed playing behaviors. This is a big one. Gregory really never picked up a car and like zoom, 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 like you see kind of them kind of just falling naturally into play. He didn't do that. It wasn't like he would sit there and do the, what would be maybe more the typical or classic presentation of like spinning the wheels. He didn't do that, but he would study it. And then he was always doing his groupings of 3. Everything was grouped. At 1, he was color coding Easter eggs. He didn't know the colors, but he'd color code all the Easter eggs and everybody else's Easter eggs. And I'm like, you don't know the colors, you're 1. How are you doing this? So that hyper focus, which I learned was his ability to really hyper focus, right? But it wasn't like, the other children were looking for the eggs. He wasn't worried about that, so those type of things. The delayed play behaviors, he really didn't have that joint attention wasn't there. I didn't know what that was called, but even with me or with other children, he didn't have it. He was very happy with solitary play. And, everything was in 3s, everything, everywhere, little pockets of 3s, little, whatever creations at the beach with 3 stones or, trucks, whatever it was. So he played differently. His play looked different. And then the repetitive behaviors, as I said, and that hyper focus, and then sensory issues. So he didn't have really big sensory issues, like kind of how you would think of it, but it's kind of like, is it or isn't it? And it's kind of very black and white, right? It's kind of, so, his biggest texture thing was oral. So he liked pureed foods and could go from pureed to crunchy. So we knew it wasn't a swallowing issue, right? That was that. So because he had tubes and all these things, our SLP said, their gag is very sensitive. They can look at something and vomit, or start to gag. So we knew that it was that, but that could have also been part of the autism at that time. And I didn't recognize it as that. I just knew that was the only thing he had. And then, it wasn't really loud noises. However, in knowing he did, so he hand flapped, but if you blinked, you missed it. And it was very few and far between. And it was like, wait, did I see him hand flap? Like when he was excited. And then he'd do this, 1, 2, 3. But if you blinked, you'd miss it. And it wasn't all the time. He was always a toe walker. So physio was working on getting those heels down 80% of the time. So there was a physiotherapy explanation for that. So, but he was toe walking.
It's just a confusing time. And I think when you add prematurity to the mix, it just gets more confusing. But let's fast forward. How's he doing now?
So he is doing amazing. He is in all capacities. He just finished his first year of preschool. So early, the Bright Start, he did amazing. His principal loves him. His teacher loves him. He was given a paraprofessional, and that was amazing. He's doing great. He's talking. We've worked on language intensively this summer. And so we're trying to get those longer sentences, but he's talking, but he's not conversational. So we're moving towards that, but he's doing amazing. I've had him in soccer. I've had him in swimming, it's like his 3rd year of swimming, 2nd year of soccer. He's doing great. He is going to be in preschool, the 4-year-old preschool in September. So we're excited about that. So he's doing everything that he needs to be doing to get to where he needs to be. And everybody's quite pleased. His doctor, everybody, physio, OT. There is some sensory stuff that we're working on. So we've linked up with another OT because our previous OT is super busy. She made a great recommendation to another wonderful OT, and she can see that there's still some sensory integration that needs to happen. So, we're kind of going to hit that hard and try and do that. And we'll probably see some of the other areas follow suit because of that sensory integration. So he's really doing great. He did come up with something new in the past couple of months. It's like a vocal tick, like a clearing, a throat clearing. We weren't sure if it was allergies. Doctor said it might be allergies, but he continues to do it. And a visual, so the side eye stim, the visual stimming. And then also he's had like a few meltdowns, which is really uncharacteristic for him. So we're going to see if there's any medical component to that, because as I've learned with you, sometimes that can be an underlying medical something. So
especially throat clearing, that to me, I would get a clicker or tally it,
Yeah.
set a timer for 10 minutes, get a video that you can show to the doctor, tally, like I remember, and then that can go hand in hand. If it is PANS, pediatric autoimmune neuropsychiatric disorder or syndrome, and we can link our couple PANDAS talks, podcasts, a video blog in the show notes, because it's really important. Like typical kids and kids on the spectrum can develop PANS and PANDAS related to not just strep, but staph and mycoplasma, all kinds of things, Lyme disease. It can make your brain fire that causes tics, OCD, and it can cause problem behaviors too. I remember one student I had in a classroom, and they were like, and I knew this kid from age 2, and he was probably 8 or 6. And they're like, oh, this kid is really not doing well. He's actually peeing in the corner of a classroom. I'm like, what? And I go in, and, you know, this kid all of a sudden had huge problem behaviors. And I noticed that he had excessive eye blinking, which was new, and throat clearing. And I took data, set a timer, took data on both. And, you know, mom went to the doctor, it was PANS, and she treated him with antibiotics. Like it's not out of the question. The other thing before we move on, and we're going to finish up soon, is really get a calendar, a physical calendar, a monthly calendar. I have a calendar blog we can put in the show notes, but basically keep track of medical appointments, blood tests, ticks. The tick rate might go up and down. And if you start antibiotics, so when Lucas had ticks, all of a sudden it was 500 a day for multiple days. And then it was, we did antibiotics day 1, we wrote in the calendar, day 2, you know, and by day 5, the ticks went away. So like, that's the kind of thing that you need, because he needed to be treated for ticks like many, many more times in his life. And, you know, like it can get really complex. And the other thing about problem behaviors is, you know, as a behavior analyst and a nurse, I mean, we also need to make sure that people aren't reinforcing the problem behaviors, that you take the turn tantrums around mini course, which is part of our online portal that you have full access to. And the other thing about talking but not conversational, and like people like Jannette, and you've taken the toddler course, I know, you've taken the train the trainer course, I know, and you just took the 5 days to more coaching, 5 days to more talking coaching week. But I'm not so sure that you have sat down and watched the entire early learner course and intermediate learner course that you absolutely should do. And it is multiple hours. It's probably, I think, 30 hours of content, but it is so important, because when you have a child like Gregory, getting him to be conversational without messing up his language, you know, stringing words together, you know, it is really tough. And so, you know, you're a big believer in my program, but just don't skip that thinking it can be solved by an eclectic approach, because I really do believe that my intermediate learner course is going to be the solution to help him get conversational, or as conversational as possible.
Yeah. So in with your courses, and I, you know, I do the monthly membership so that I, you know, as he grows, and I can learn and grow as well. But I've learned just as much as what to do as what not to do.
Yeah. Yeah.
So what not to do, which is just as important, right? And when to do it, and when is the right time, and how many words do we have to have before we can expect to be able to make those, you know, those kind of those jumps, which is hugely important. And I think for me too, being a first time mom, right? That was being a first-time mom to a micro-prem, right? But I think you helped to see, because it's really through your program that I knew that this was definitely not prematurity. My friend, thankfully for her, and she, you know, when she showed me her twins at 2 singing on that coffee table with the microphone, listening to their name, and my son was not doing anything like that. You know, that was hugely helpful, and I'm forever grateful to her too. But in looking that up, you gave me, you know, really clear, defined things of what autism looks like, and when it's not, happening the way it should, that we need to find out, so whether it was autism or not, I needed to know that.
Yeah,
I needed to find out. It could have been delayed, it could have not. So, we did the ADOS, which is the gold standard of diagnosing, that. And, but, also to move through that denial as a parent, it feels like you're walking through concrete sometimes, just because the denial can be so thick. But to move past that, the importance, their brain is developing, that early intervention is so important. Lucky for me, there was no waiting list for our ABA. I was able to get him in there really 8 months before he actually got a firm diagnosis. So we started like 3 months before that to start the diagnosis process. But by then I had already made huge strides because he was an ABA, because I learned not only do I take him for 12 hours of ABA a week, but then what do I do? So I needed to know how to communicate with my son, how to teach him. And you taught me that, and you continue to teach me all the time. And everybody says, Jannette, he is doing as well as he's doing because you work with him at home. And I always tell them, Mary Barbera, she really is my guru. That's where I've learned. And it's kind of like giving you a child that speaks a different language. Here you go. How do you communicate with that? In the traditional ways that I'm used to being around children, it wasn't working. So you gave me that gift, and he is doing as well as he's doing, because you've taught me, music therapy. Huge. That I didn't know.
We have a interview with a music therapist.
That's where I learned about it.
A BCBA. We can link that in the show notes.
Yeah.
But yeah, and 50% of our toddler preschooler community joins the online course and community before they have a diagnosis of autism. Some just with the speech delay never get a diagnosis. So if you're listening, you don't have to get a diagnosis. You don't have to, even think it's autism, because there's nothing like this to help premature babies, to help typical toddlers, to help kids with just speech delays. There's nothing like this. So
no, and what you've always said, which is hugely important, and it spoke to me, is that it's not going to hurt them, right? It's the same therapy for someone who's speech delayed, or global delayed, or who has autism. It's the same therapies. It's the same,
child friendly, and
it's child friendly.
Parent friendly.
Yeah, he loves it, even at his ABA, it's for verbal behavioral, approach there. And he just can't wait to get through that door, and he just,
that's what you want.
Right.
You want the child to want to be with the therapist, to not scream when the doorbell rings, to not cry in the car on the way. And I don't care what you call it, ABA, speech, OT, whatever therapy. If the child is responding negatively with the doorbell ring or going into a school, a placement, something has to change. And the only way to do that is for parents to learn more about what they need to do. But I do want to wrap up. I think you're just a wealth of information. I could interview you all day long. But before I let you go, as you know, part of my podcast goals is not to just help the kids, but also how to help the parents and professionals lead better lives. So do you have any stress reduction or self-care tips for us today?
I do. So I thought about that because I know you do this. So, sometimes it's kind of hard, especially when you're in the thick of things, and, that looks different for everybody, but, we're working so hard with our kids that sometimes, getting a day away, I mean, that's ideal, right? A spa day or something like that is difficult, but it's kind of the small moments throughout the day. So sometimes I'll get up a little bit earlier than everybody in the house, than my son or my husband, and I have my cup of coffee, and I might sit outside if it's a pretty day, and just have that kind of those moments that are just mine. Right. Or maybe after he goes to sleep, I will, have a cup of tea or watch something that I like, Netflix or something that, is non-stressful. But just carving out those moments. Sometimes it's a big ask. People maybe don't have, friends or family that can support in those ways to watch them for hours or a day. And it's just those snippets of time to kind of just keep us, the stress reduced and kind of filling our cups, right, with things that help us to kind of, to help promote more self-care towards ourselves. So I would say if you can't, get a whole day at the spa, or, you can't, have that type of time away, but even those small nuggets of time that you just carve out in your day, that are just yours. Sometimes before I pick up Gregory at his ABA, they have these huge, beautiful trees, and I'll go 20 minutes early and sit under the trees in the car, roll the windows down, let the breeze come through, and I'll just relax. So it might look like that. You know, I just kind of carve it out wherever I can. And sometimes we have to be very creative in what that looks like, and and that's okay. So
Yeah,
that's my
that's
tip.
great. Great advice. Well, thank you so much for your time. I
Thank
look
you so much,
forward to
too.
being on your journey for many years to come. And I'm
Thank
sure my
you. Yes.
listeners will love listening to your story. So thanks again.
Thank you so much. Take care.